I understand it has been quite a while since I've posted anything on my channel. Just gonna make it a bit casual, nothing scripted here. I'm standing beside my kids' room window, so there's gonna be a lot of noise. Don't ask me why my choice of location for shooting this particular vlog. Yeah, so a lot of things has happened in my life in a short period of 1 month. First of all, I'm not sure if any of you know about it, but I was admitted to the hospital for about 4 days for a case of low platelets. Platelets are essentially things in your blood that help with the clotting. So if you have any kind of bleeding or whatsoever, these platelets actually help you to stop the bleeding and that kind of thing. So in my situation, I have pretty low platelets. So to explain further, so the normal humans has about minimally 140,000 deciliters, was it milliliters of platelets? Can't really remember the actual figures, but yeah, 140 is the minimal. And when I was admitted, I only had 17. 17. Yeah, which is pretty dangerous, pretty deadly. Yeah, so how I actually came about to, discover this low platelets thingy is couple of months back, sometime in December, I was having this unexplained bruising around my legs and around my body as well. So I ignored it. I totally ignored it completely until my wife was the one who actually pestered me, get yourself checked, get at least a full blood count done for yourself to see if anything's going on. Yeah, so that's what I did 2 months later, and this is what I found, 17 for platelets. So the lab actually called me, told me to go to the nearest emergency room and get myself checked in. Yeah, which I did for 4 days. It was quite miserable, being on having low platelets and all your movements or wherever you can go or whatever you can do in the ward is pretty much limited and confined to your own bed only. Yeah, so 4 days. After the 4 days of admission, I was discharged and they diagnosed me with possible ITP. ITP, which is immune thrombocytopenic purpura. It's somewhere here, so you can read it out. Okay. Yeah. So actually, immune thrombocytopenic purpura is basically a immune disorder where your blood doesn't clot as well, and you are pretty much prone to excessive bleeding and or bruising. Okay, so this disease can be pretty dangerous, if I were to sustain a big injury, over my head, something like that. Because of the lack of potential to clot and the ability to bleed. I may have unexplained bleeding over my head, which could possibly lead to a stroke or something like that. Yeah, so that's the thing. No high impact sports for now, no high impact activities. Yeah, so after discharge from hospital, I was referred to the hematologist over at Singapore General Hospital. So at the point of recording of this video, I've already gone for 4 outpatient consultations. And which is why I came about to doing this video. I want to share something with you which I really didn't know until I was on it. Yeah. So what happened was during the second visit of my hematologist appointment, I was started with oral steroids. Pretty high dose, 80 milligrams per day, once a day. Yeah, so I just want to share with you the effects of this oral prednisolone and what it's actually doing to me, and just want to share with you as well how I actually try to cope with this new diagnosis of mine, which is pretty much restrictive. Yeah, sorry, had to pause for a while there to feed this new guy. Yeah. So this is one of the many things that happened during this past month. Okay, yep, so I just want to share with you guys, the effects of oral prednisolone and living with ITP. One of the many reasons that I want to share on this experience of oral steroids, because personally, for myself, as a nurse, we do administer oral steroids to our patients for various and multitudes of medical situations. But for myself as a nurse, I'm pretty much guilty of not knowing the effects that comes with it. At least to understand what my patients actually go through when they are on these medications. Yeah, so like I said, for myself, I'm on a pretty high dose, 80 milligrams per day, and as you can see, some of the effects already started showing. Okay, this is the water retention on your face, torso, and your legs, and the many symptoms. Other many symptoms of oral prednisolone also includes headache, dizziness, restlessness, jitteriness, insomnia, and so on and so forth. Most common in the first week, the most common effect that I had was actually the headache and the restlessness. It was really bad. I had a tough time focusing. I had a hard time trying to sleep, and especially with this new guy. So well, I guess it's important to know that if you do know a person who's on long-term steroids, and if they do appear restless, or if they do appear agitated, or if their mood is a bit off, just try to understand it's not really them. It may be the medication altogether, because that's pretty much what's happening to me right now. So just to conclude, my first week of oral prednisolone, it was a pretty tough week for myself. Okay, had trouble adjusting to the medication, had trouble adjusting to the effects of the medication. Why I'm doing this segment on oral steroids and ITP is that I think it's a very small community of people who are diagnosed with ITP, and I'm not sure if there's an outlet for them to share their thoughts, share their experiences. Because having ITP means that your lifestyle kind of have to be adjusted altogether. I'm pretty much an active person right before this with rock climbing and all. So with this, am I allowed to still rock climb at all? Am I still allowed to exercise as hard as all? I don't really have the answers for now, but I intend to explore it along the way. Gotta keep myself healthy for the family, for this guy. So I'll keep you guys updated, okay, on my next follow-up appointment.